Changes in the healthcare system have a lot of Americans worried about the future. But for local Hispanics, they're struggling to be even part of the debate. Their first hurdle is communication with their doctor. KOMU 8's Susie Steinmal tells us what one local organization is doing to help Hispanics have a voice.
Imagine going to the doctor but not being able to tell him what's wrong. How might you feel? Frustrated, intimidated, afraid? Well, that fear is a reality for many Hispanics living in Colombia, and it's one of the reasons why Hispanics aren't receiving the medical attention they need.
I don't have sufficient financial resources to have my own doctor.
For Alberto, it's a financial issue, but for others,
para los hispanos, el idioma.
For Hispanics, it's the language and also transportation.
For the rest, it's a lack of education. Whatever the reason, 40% of Hispanic immigrants do not have a regular health care provider and aren't getting the medical attention they need.
Many do not have a regular doctor, and they wait until they're really sick before they go.
It is certain that there is a fear of going to a doctor and not being able to speak your own language.
The Centro Latino is trying to change that. Promotoras de Salud is a program started by the Centro Latino that aims to educate immigrants who don't understand how the healthcare system works.
These people are used to the emergency room. The only difference in medical practice is that in most Latin American countries, treatment at the emergency room is free or costs very little, but here it's the most expensive option.
Making unnecessary trips to the emergency room is a common mistake Hispanics make, a mistake that can cost them hundreds of dollars.
If you go to the emergency room for the same treatment, it's going to cost $500, $600, or even $1,000 for one visit. This is one thing we need to help people understand.
Latinos make up 14% of the Colombia population. They're 3 times less likely to have a consistent source of health care and 1.5 times more likely to use the emergency room as their primary source of health care.
When asked about the quality of health care, 76% of Latinos say the care they received was excellent or good.
For me, my experience has been, in terms of medical treatment, excellent. The quality of medical treatment here in Colombia is more than sufficient.
However, when asked if they received poor medical attention in the past, most admitted they face problems the rest of the population doesn't. 46% say they believe their accent contributed to their poor care. 43% say they believe their inability to pay contributed to their poor care. And 37% say they believe their race or ethnicity caused them to receive poor care. Crespi started Promotoras de Salud to give Hispanics a resource that will help them find the health care they need. As the Hispanic population continues to increase, knowledge on where to go spreads.
Their best network of information is each other.
With each other's support and a growing number of resources in the community, adequate medical attention for Hispanics may no longer be a foreign concept.
The Centro Latino has seen more than 4 times the amount of Hispanics ask for help in the past few years. Crespi credits this to a combination of population growth and knowledge of the Promotoras program. To view this story in Spanish, log on to our website, KOMU.com, scroll to the bottom, and click on the KOMU en Español icon.